Hey everyone, this is Laura Cole. I am here today to present to you about my educational design project, and the topic is dementia care in the skilled nursing facility. Anyone who knows me or has been in class with me previously knows how passionate I am about dementia care within the skilled nursing facility, so this worked out perfectly. So the necessity for creating education for dementia within long-term care comes from the fact that we have so many long-term care individuals that suffer from dementia. It's determined that approximately 50% of individuals living within skilled nursing facilities have a diagnosis of Alzheimer's disease or dementia. We like to provide education for our staff at all levels to make sure that not only are they adequately providing care, but we want to make sure that they are providing care that's essential to the residents, as well as providing evidence-based care as appropriate, as well as the up-to-date treatment approaches. This also focuses on approaching to learn from all aspects within the skilled nursing facilities. So certified nurses assistants, licensed practical nurses, registered nurses, and recreational therapists or activities personnel. One of the most important pieces within this presentation is that, I appreciate that learning should be individualized, but it's essential to understand that we cannot provide one-on-one learning experiences for everyone that's involved as much as we would like to. We would love to make that happen, but where we can integrate that is when we're providing patient care and making sure that we are doing appropriate staff and facility training with that. Hoffman et al. Explained that it's anticipated that the number of individuals with dementia and Alzheimer's disease will almost triple by 2050. So really this is an essential topic for all skilled nursing facilities and personnel to make sure that we are truly achieving what we can achieve for our loved ones and those that we serve with dementia. So the in-service that I designed was going to be a small, intimate in-service for approximately 5 to 10 individuals, allied health professions, including CNAs, LPNs, RNs, and recreational therapists. The in-service itself is 2.5 hours long, one class at a time, but provided multiple times to different groups of people. A face-to-face type organization, not necessarily within a conference room, but something simple within a skilled nursing facility, a classroom setting. Can be a discussion, and the tables are going to be within a circle, or the chairs are going to be within a circle, so everyone is truly involved together. Education ranges for this group are tricky because CNAs often have a GED or high school diploma with professional certificates. We also have staff who would have associate's degrees, bachelor's degrees, and master's degrees. And they must be currently employed by the skilled nursing facility that this was being completed in. So in relation to theory, I found that I would utilize a combination of the behaviorist model, humanist learning, and social learning. Focusing on the behaviorist model, we truly require the extrinsic motivation for these types of in-services to be completed. So it needs to be a requirement from, unfortunately, the skilled nursing facility, but also to learn and truly provide the appropriate behaviors. We're making sure that the staff is following these behaviors appropriately. Through the humanist approach, we want to make sure that every individual truly feels like they're being fulfilled and they are continuing their education. And social learning, truly allows for the buy-in from all individuals involved. As I said before, there must be a combination of intrinsic and extrinsic motivation for the individuals who are participating. This will improve carryover and retention of the activities and provide additional insight throughout the in-service. The buy-in from the individuals participating must be or may be difficult to obtain initially, and this is typically because of the individuals that participate within the skilled nursing facility. So the learning outcomes for this in-service include identifying concerns in previous experience regarding individuals' experiences providing care for persons with dementia, to provide background information regarding prevalence, types of dementia, and other dementia-related facts through a bulleted list of information and definitions as a reference. Each individual will develop strategies for improved outcomes for redirection, providing self-care tasks, and developing and maintaining a rapport with people with dementia. We will also develop the ability to appropriately analyze a scenario while working with persons with dementia regarding their mood, the environment, and potential perceived behaviors. We will identify and develop an understanding for individual reactions in situations regarding treatment of individuals with dementia, and develop an understanding of continuing landscape of dementia care and growing prevalence within the aging population. So outcomes 1 and 2 truly focus on the foundational learning of the individuals within the class. So a brief questionnaire has been provided to each individual, which utilizes problem-based learning or can focus on problem-based learning when we can discuss the scenarios that are involved. So this questionnaire will also include just a little snippet of if they can give an explanation as to what their current level of understanding for dementia is, or a particular experience that they remember from working with an individual with dementia that was difficult for them to assess or continue the care for them. As well as the fact and explanation portion. So foundational knowledge, we're truly providing definitions and explanations for possibly why certain individuals with dementia have certain behaviors. So that's a lecture portion. Outcome 3 is developed through application. So this is where we have a group discussion and review the questionnaires. This is in conjunction with the problem-based learning, where we truly all can discuss the situations or scenarios that the staff have included on their questionnaires as to, troublesome times when treating somebody with dementia. Outcomes 4 and 5 are a combination of integration and human dimension. This is a role play activity. So there are 3 scenarios that were created by me and are presented to each of the individuals in the group, and each individual has to take those scenarios and explain how they would address their focus with each of the residents within that scenario. And then we will be broken up into groups to role play the activity. So some of the staff will be audience members, and other staff will be playing caregivers, and other staff will be playing the part of the individual with dementia. So this is focusing on problem solving and critical thinking, making sure that the information that was obtained through the lecture has actually sunken in, and the retention is necessary. So outcome 6 is learning how to learn, and additional information through the lecture will continue just on the outcomes of what is expected with individuals with dementia, or life expectancy, simple facts that might not necessarily be essential to creating an appropriate environment, but these facts will help to design how important it is to continue our need for dementia-based services within skilled nursing facilities. This will also include a debriefing on the end of the role play activity, so everybody can discuss positives, negatives, constructive criticisms of what they would do differently, and also gives all of the staff within the group an opportunity to review what they had suggested that they would do on their scenario sheet. So major course topics include definition of dementia and types of dementia, identifying personal experiences while working with persons with dementia, perceived behaviors in persons with dementia, providing care for persons with dementia, reading a situation or behavior concerns for people with dementia, and adequately diffusing a situation for persons with dementia. I felt that these major course topics were the necessities that all CNAs, LPNs, RNs, and recreational therapists could really utilize on a daily basis while working with individuals with dementia. These are the key focuses of the role play activities as well. So the course outline, you can see at 3 p.m. we have an introduction and completion of the brief questionnaire. 3:15, introduction lecture and dementia facts review. There would be an informational packet that each student or staff member could really return to their environment with. At 3:45, review the questionnaire and group discussion. At 4:15, discuss perceived behaviors and environmental modifications. 4:20, role play scenarios provided, and they can apply those through what they learned within the previous section. Role play activity takes place at 4:30. At 5 o'clock, there would be a debriefing and discussion, and at 5:30, the in-service would end. Through the feedback and assessment, there really truly is no formal assessment, but this course is being completed in a short period of time. Behaviorism is really relied on heavily to continue following the course. Role play was the assessment portion that identified if the lecture material was truly understood. And at the end of the in-services, students were provided the opportunity to express if the shortened service allowed for better understanding throughout their daily tasks. It wasn't completed formally, however, I felt it was a necessity for the staff that were involved to truly speak their mind on what they feel like they gained through this activity. So my conclusion is focusing on the quality assurance and performance improvement. So the Center for Medicare and Medicaid Services started the QAPI movement in 2016, which is a combination of quality assurance and performance improvement. And within the skilled nursing facilities, it's necessary to have a true area of necessity for improvement. And dementia care is definitely one of the higher ranked necessities within the region that I work. So we kind of focused on dementia care to allow for better carryover for our residents and better staff understanding. And I truly felt that it was a good jumping off point to provide necessary and appropriate care for the individuals we serve. Really hoping to continue to expand this presentation and to allow for others to be involved as well. We as practitioners can provide excellent evidence-based practice necessity to anyone that we serve. So that's my focus with this. The next page is my reference, and last page is my references.